First of all, I would say that, and I agree with Dr. C, the vaccines are funded through what we call counterpart funding. The government of Kenya puts as amount of money and pays, they contribute, the government of Kenya contributes a part of their money to the kitty. The UNICEF, the World Health, these organizations, USAID and all this, also put their money, and then that money is taken to the manufacturer. Vaccines are booked. Vaccines are not prepared like bread. You bring today, you order today, you get tomorrow. Vaccines are planned 5 years in advance. So you know, next year we will need this amount of vaccines. So the World Organization puts their donors put their money in the fund. They expect the government to put their bit of money, and then the vaccines are scheduled to be brought into the Republic. Now the problem is, our government have not put their money, which is required to bring the vaccines. So the vaccines, which we were supposed to book for the next 2-3 years, we have not booked. So we do not have that vaccine because we have not put our resource. The World Organization, the donors, have already put their money, but their money cannot buy. They wait for you to put in the kitty as well. That is one. The biggest other problem is that the government knows very well we do not have capacity to store the vaccines in large numbers in Kenya. 90% of our public hospitals do not have fridges to store these vaccines for a year, for 6 months. That's why these things are scheduled to be brought at a certain time. When you need them, that's why you see when you are doing polio jabs, they walk in the villages, in the streets, in the estates with them.
Yeah.
BCG you get in the hospitals. Now the problem is, the available vaccines will be available in private hospitals. The poor people who are supposed to have these vaccinations will not get for their kids. And we are putting a whole generation at risk.